So many of us decided to push back regular screenings and primary care checkups during the pandemic, and now doctors say you can't wait anymore. When you wait, you miss out on steps to keeping yourself healthy. And we're going to talk about the importance of primary care and the types of services those physicians provide. We have Dr. Stacey Blyth from Cone Health here with us today. She works in the LeBauer Primary Care Department at Med Center High Point. All right, so first and foremost, let's just talk about this, all right? We heard the term primary care provider, but what medical specialties and types of care professionals does that include?
So it's a pretty good list. It's family practice, which is what I am, and then there's internal medicine, who does just adults. Family practice does adults and kids. There's something called med peds, which is adults and kids again. Then there's pediatricians who do, depending on their practice, up to roughly age 18. OBGYN will take care of women, especially in sort of their reproductive years, as primary care doctors especially. Those are the main ones, and they'll be both medical doctors, doctors of osteopathy, DOs, and then of course what we call APPs, or physician assistants, and nurse practitioners will work with us in those roles to do primary care as well.
Okay, now I didn't realize that umbrella was that big. I was just thinking your OBGYN was one kind of specialty doctor and then the other one was your primary care. So that's good to be able to kind of figure that out.
Yeah, well, and it's some people handle it differently, but quite often what we'll do is, because family practice does teens, kids, teens, and young adults, I'll keep young women until they're getting close to thinking about kids, and then when they're ready, they'll transfer off and do a lot of their care with OB while they're in those years having their kids, and then they'll come on back. Of course, they're always welcome here, but of course it gets hard to schedule so many visits. So we try to work with people so they can do what works for their lives.
All right. So at what age should someone consider having a primary care provider?
So I don't think that has age limits. I think from birth to the grave. Little kids, of course, I mean, we've all, or many of us have been there when we have little kids. I have my first grandkid recently, and my daughter's anxiety is through the roof, right? So newbies and little babies, you just need that, all those shots and all that hand holding. Then as we get into the teen years, I've thought about this a lot. With the pandemic, we've all watched how much kids and teenagers have really suffered. So having that ongoing relationship with the primary care doctor that's another trusted adult in their milieu is going to be very, very helpful to get them through some of these trying times. And then young adults, even all the time, they feel like they don't need us. They'll be young and healthy forever. And goodness knows, I hope that's true for as long as possible. But we all know curveballs come in life. And so to have that established relationship, if something difficult happens anywhere in your young adult life, is still really, really helpful to answer questions and block out some noise around what's real information. And then, of course, as we get older and start moving into all the aging fun and games, we need more screening tests, and we need more blood work, and we need to keep a closer eye on things. Then, of course, more than ever, you need a primary care provider. But I just think there's not an age where there isn't a benefit.
Right, because you hate to be searching for a doctor when you think something is starting to be wrong and not have that relationship already established. Okay, so you just touched a little bit on screenings. So let's talk about that. During COVID, a lot of people put off getting their preventative screenings and their annual physicals. So just how important is it that we get back on track with that?
Really, in my world, incredibly important. So I'm sad to say, I have seen, as people have come back and kind of gotten outside and back into the medical world, we are seeing more breast cancers and more colon cancers and things that just got pushed off a little bit. So I really encourage people, get back in, let's make sure everything's good. Mammograms, of course, find breast cancer early. Colonoscopies, not only can they find colon cancer early, they can actually prevent colon cancer. So they're as important as anything, even though I know that's one of the things people are most worried about. If we get in there and we take out that polyp, you're not getting cancer next year. That's a beautiful thing. So it's really important that people get back out and let us start doing all that screening again. Yeah,
and that hits very close to home with our own Julie Luck, who went for a preventative colonoscopy and found out that she had stage 3A colon cancer, and she is now in treatment now. And her big thing is get screened, do not wait. So we want to make sure that you guys hear that from our own Julie Luck as well. Okay, let's talk about additional healthcare services. How does having a primary care provider help with additional services that you might need?
So, of course, it depends a little bit on your insurance product, but many of them will require a primary care referral to see a specialist. It's also true that quite often people won't know which specialist to see for which thing. So I serve as the gatekeeper to tell you, okay, given that symptom, I think ear, nose, and throat will do you more good than, you know, an allergist might, for instance. And I can kind of help navigate those waters. I can help you find someone who is in network, maybe close to your home, your insurance carrier might cover, that I have faith in. I think it just helps people navigate this really complex medical environment with a little more confidence, because they know I can help them figure out how to get to someone that they really can count on.
Yeah, because you hate to be thinking to yourself that you're diagnosing yourself online, right? Or just looking down a list of names that you just don't know and picking somebody.
Absolutely.
Okay.
Yeah.
All right, we're going to take a quick break. We're going to continue on, though, with talking about primary care and needs and things of that nature. We'll be right back. We are back with Dr. Stacey Blyth. She's talking about the importance of getting primary care. Okay, so this is one of the stumbling blocks, right? Sometimes we just don't even know how to go about finding a primary care provider. So kind of walk us through the process there.
So I work with Cone Health, as you've already said, which is a great not-for-profit system in our area that covers multiple counties, 5, I believe. And we have set up on our website, conehealth.com/primary care, as a really good starting point for how you go ahead and go in and figure out who's in your area, who has availability. So that's a really good starting point. Word of mouth is always good. Every system has access, but that's certainly how we do it. Beyond that, it really becomes a matter of sort of talking to friends and figuring out what works for you. But conehealth.com is a really, really good starting place.
All right, so what would you say to people who think they can just go to the emergency room and just use that for their primary care instead?
So mostly I would just address the fact that, as we all know, insurance deductibles, co-pays, access is just getting trickier and trickier, right? An incredibly high percentage of the American population has medical debt, and high cost care like that is really a big piece of it. So there's so much that we can do in the primary care setting that's going to be a nickel and a dime compared to what you'd have to pay for in the ER. And as we all know, with COVID, our emergency rooms have also been just absolutely overrun. We only have so many rooms, so many docs, so many nurses, and we really have to save those services for people who are truly in dire straits. And then we need everybody else to help us get them established with a primary care doctor, so we can take care of the simple things before they're big things and keep them out of the emergency room, which is a much scarier, much more expensive proposition.
Mm-hmm. So when someone is preparing, like for their first primary care appointment, what things would you recommend they do for a successful visit that they can prepare ahead of time before they go in?
It's a great question. So the biggest thing is just really, you know, write yourself a list of the medical conditions you think you've had. Do your best to pull together your family history to the best of your ability. Pack up your meds and bring them with you. I want to see those bottles if I can. If you've had screening elsewhere, especially if you've moved to the area from somewhere else, so I can't go through my computer to kind of grab stuff from people nearby. Any copies of any reports you have, bring them with you. But the biggest thing is really make sure that you're ready to ask your questions so you get your needs met, and then be prepared to then establish a relationship with me, and we start a cadence for how we start working on what you need.
Yeah, and bring all of those other things that you take, like supplements and stuff too. Bring those, even though they're not prescription, because she needs to know them.
Absolutely. They interact with some of your meds, and I take supplements. I'm not anti-supplement, but the reality is just because something's natural or not prescribed doesn't mean your kidneys and your liver don't have to metabolize them, and there can be consequences from time to time. So I need to know, to take good care of you, everything you're taking, so that I can really give you a full picture of what I think it's safe for you to do and not do.
Right. Okay. Just how important is it to get an annual physical with your primary care provider? Not just going in for the aches and pains, but an annual physical.
Right. So that's a great question. And in my medical journals, we debate that from time to time. But I think in the end, we're very social creatures, and medicine's a very social proposition. Yes, we need to know the science, we need to have the information, but there's an art to it. And if you have an established relationship with the cadence and you come in for an annual visit, and last year you're getting older, no falls, this year you fell once, let's talk about that. Let's figure out what happened so we can get you some physical therapy, adjust some things in your home. And by doing sort of that annual cadence, or more often, if you have more conditions, we're going to find the little stuff before it's big stuff and really keep you out of trouble for longer. Because if we're all lucky, we're going to age. And with age comes more sort of upkeep.
And when we have that annual exam, we get all those numbers back, we should probably be asking questions. I know it says it's in the normal, but is it high normal? Should I be doing something else?
That's right. And the trick is, if we have that established relationship where you're comfortable asking that question, the reality is some of your numbers come back and they don't worry me at all, but you don't know that. So you have to ask, MCHC is this little statistic around your red blood cells. Since I did pathology in med school, not a concern, right? But if you don't have that relationship with me to ask it, you're going to worry about it. You're going to Google it and scare yourself. So if we have that right, it's Dr. Google is a menace when it comes to mental health in that sense. I'm all about people engaging in their own care, but it stresses people. So yes, ask the questions. There's never a stupid question.
That's right. Ask your doctor all the questions. All right. If you missed any of this information, we're going to publish it in the To Your Wellbeing section on our website.